Morning. Just adjusting my mic real quick. Give me a second. Okay. Hope everyone can hear me. This morning we're going to talk about effective strategies in RAGAGEP application, specifically for PSM RMP. I should say good afternoon for those of you if you're on the East Coast, because it is afternoon for you after lunch. Essentially, a lot of this RAGAGEP is being taken from IAR Standard 9. Which is still in the final developments. Talk a little bit about that, but the draft is essentially final. They're doing some final comment periods. So we'll talk about what those requirements are, what the standard says as far as RAGAGEP for ammonia refrigeration. For those of you who don't necessarily have refrigeration systems, but potentially just ammonia and another type of system, or that they can translate these standards into something maybe you should look at to develop your own site-specific RAGAGEP. We're going to go through what is RAGAGEP, where the sources for RAGAGEP are, especially for those of you that may not be in ammonia refrigeration, that what those standards are as far as IR 9 is concerned, and then talk about what's going on with the regulatory environment. RAGAGEP is a CCPS definition. That's a Center for Chemical Process Safety. Essentially, it's the basis for engineering, operation, or maintenance activities that are based on established codes, standards, and published technical reports. And I broke that down a little bit easier to read in this graphic. It takes engineering, operation, and maintenance activities with the established codes and standards and generally approved ways of practice, so basically your best practices, rolled into one standard. This not only applies to design new systems, but also practice with existing systems as well. Sources of RAGAGEP fall under three categories. The first and most important being published and widely accepted codes. These are your federal, state, and municipal codes under the jurisdictions, so your NFPA requirements, building codes, local permitting, requirements for new systems. This would be basically at the government level. Then there's consensus documents that should be looked at next. These are in order of importance. So those would be established organizations that have a represented membership from a diverse group within that industry. Those are like ASME, ANSI standards, IAR, and then the non-consensus documents would be your Chlorine Institute, if you're in water treatment, CCPS guidebooks, technical articles, and other general industry best practice. Basically, the requirements here go from more detail to less detail. The best practice should always be applied, at least as most regulated. And again, a lot of these documents are minimum standards. It's important to note that there may be more required or may be more applicable to your specific facility, and these should be taken as minimum standards to do that. IAR 9 and IAR 6 are specifically addressed or actually called out on this slide because IAR 9 is the standard for RAGAGEP in ammonia refrigeration, and IAR 6 is referenced in IAR 9. I believe I have a little description on some of the following slides. Yes, IAR 9 is still undergoing approval. It's anticipated to be finalized at the beginning of 2019. That is very important when we start talking about the RAGAGEP evaluation that's required as part of this standard. And I'll point out why towards the end of this presentation. But that's important to note is that beginning of 2019 is where they're looking at to finalize this. They were going through one more review period. I believe it's open right now, or it may be shortly within the next few weeks. And again, addresses the minimum standards for these systems. And within this, IAR 6 is referenced. IAR 6 is the standards for maintenance, testing, and inspection. So IAR 9 references that in terms of the frequency and what kinds of inspections and things. We'll probably do a separate webinar on IAR 6, but essentially IAR 6 is taking B109 and B110, which were traditionally guidance documents, and rolling it together into a standard that will now be for ammonia refrigeration. So we're taking some kind of guidance and now moving it into a standard that will be ANSI approved. IR9 established some definitions that just weren't established before. Part of that was just defining change, like changing a system. So anything other than replacement in kind, they add that definition. Some definitions as far as qualitative analysis for PHAs or for this evaluation, and defining risk ranking method. Some things everyone should be familiar with that comes up with the PHAs. They go into a little bit more detail as far as addressing those definitions specifically for ammonia refrigeration. And then there's a list of references as well from all of this, or from what was established here. As far as documentation goes for the RAGAGEP analysis, they're basically, the standard calls out essentially a lot of the items that are required for the PSI section in a Program 3 RMP or CalARP document, or the PSM, if you fall under PSM. What's really important about that is that even if you're a Program 2, you may have to fill in some of the gaps to meet RAGAGEP analysis with Program 3 requirements. It's it'd still be considered RAGAGEP, but from a facility standpoint, a regulator can hold you to it. So having those PNIDs, electrical classification, ventilation design, material energy balance, intended inventory, all this stuff that may or may not be existent for a Program 1 or Program 2 facility may be required at this point for the RAGAGEP. As well as those added PSI element documentation, there's some additional documentation as far as spec sheets, materials of construction, as-built design, owner's manuals, and other design information. So they're really calling out having all that information together, not necessarily within the same document as your program, but even possibly having a separate RAGAGEP document, but having that information available if there's an issue on site or if someone asks for it, specifically regulators. For inspection, testing, and maintenance, again, I referenced IAR 6. It's still not finalized, but there is a draft that IAR has sought comment on. So they're trying to finalize that, I think, sometime next year as well, but it'll be after IAR 9. But some things to consider would be improving procedures or training on your maintenance. If there's a way to do that, there's a way to improve testing and inspections based on frequency or detail, or adding things to your checklists to make sure that all the equipment's being hit, or maybe there's there's known faulty valve types that you need to add in as more frequent, things like that, or if manufacturer comes up with updated information as far as maintenance. Accessibility equipment's a big one. Can all the equipment be accessible to the right standards? IR2 defines some of that a little bit further as far as spacing with equipment and how equipment can be accessed, whether it be ladder or some kind of valve access in an emergency, especially speaking. And just addressing recommendations from these inspections and things. Some general requirements. A lot of it, again, overlaps with IAR2. So if you're familiar with IAR2 or have read it or seen my previous webinars, they essentially took IAR2 and translated it for existing systems and made it IAR9. So there are some specifics that are identical and some that are kept a little more general for existing systems. These general requirements basically go over that as far as using refrigerant-grade ammonia, having the correct pressure rating for your piping, having allowances for pressure relieving devices, materials of equipment. There's a lot of little nuances in IAR9 as far as specifics, but generally speaking, it's going to meet similar requirements to IAR2. Also, ways to purge non-condensable gases, managing oil. For instance, compressors have to have a means for sampling oil and remove oil from where it accumulates. And while that may be intuitive for a lot of people, obviously they put it in this standard perhaps because not all systems have it. So there are some specifics in here that, while a good design would probably incorporate some of these things, older systems or a design maybe gone unchecked will have to either incorporate some of this stuff or have to have recommendations to find all other means to be able to handle the system and maintain it. Let's see, and most of, I guess the bottom one with vibration, especially if you're in California, but just generally speaking, having the right materials, supports, and any supplied bracing for your movement of pipes and or equipment. There are service provisions in IAR 9 having the accessible piping and equipment. Again, going back to IAR 2 specifying actual distances, maybe referring back to that if you don't have those readily available. Pressure gauge allowances on the high side to be able to have that the allowance needed, so you don't have pressure gauges going off at random times or at your like alarm set. Your alarm set point should match up. Also, isolation valves. They bring in a lot more isolation valves on your equipment so you can isolate those and take them offline as needed, especially for package systems. For signage, this does match what IAR 2 calls out for signage, having the proper machinery room door signage for the diamond and warnings and such. So this is all from IAR 2, this picture, and that's Appendix J in IAR 2. I think when ordering signage at this point, most companies are meeting this requirement or meeting this standard as far as what they're printing for all the facilities that request it. And same with piping. This is the new standard for older systems, not necessarily, but as new labels are ordered, this is what you're going to be looking at, is the yellow or orange background with the phase and the temperature or the high pressure, low pressure side labeled with arrows. So this is all going to be standard moving forward as all the systems change out their labels. But also what's important is looking at the ASME boiler and pressure vessel code, making sure that the design and installation meets those requirements. Again, a lot of this is already done in facilities, especially newer ones, but for those older facilities, or perhaps if it's never been checked, to verify that all this is being met. Emergency requirements are actually called out in IAR 9. This takes into account shutdown valves that they need to be clearly and uniquely identified on the schematics, so on your PNIDs. So go back, make those bright red and highlighted in any way, shape, or form you can. Also that all the directions for shutdown need to be readily accessible and trained on by refrigeration staff or qualified operators and emergency responders. This does call out a little bit more on the emergency response side as far as working with the emergency responders and making sure they have the information they need in that event of an emergency. For emergency shutdown specifically, steps for shutting down the system, names and phone numbers of any personnel that need to be contacted. That's operations and maintenance, emergency responders specifically if they're off-site, and any safety personnel on-site. This could include managers at both the local and corporate levels as well. The ammonia inventory should be included on that procedure somewhere, especially for responders to know how much you could have on site, and the type and quantity of refrigerant oil in the system. For emergency planning and response, also looking at any additional emergencies to address. Are there other issues maybe that you've missed? I've seen a lot of plans that are pretty inclusive when it comes to potential bomb threats or active shooter procedures. If those emergency items are not in your plan, you may want to consider that. Okay, we just had a little flicker here. Also, coordination with local responder. This is actually I'm going to mention the new RMP rule that just came out. They just the Court of Appeals just denied that extension. So the new RMP rule is now in effect. Many of those requirements are due by March 2021, which seems like you have a lot of time, but please don't wait till last minute to look at this. We will probably be talking about that. I know that just came out, so we're still working on it on our end in our office to make sure that we get that information out to our clients. But the local responder coordination, running drills, running tabletop exercises as needed, having them come by, take a tour of the site, that's all really important. So if you haven't done that already, no matter what state you're in, you should be doing that. I know California already requires it, but now federally it's required. So start getting that in order is my recommendation. Also having your injury and illness prevention program. Even if, I know that's really a PSM requirement, but perhaps your facility may need one. It just depends. But if you do have one, just making sure it's adequate and covers all of the areas of the IIPP that are required and any potential injury causes that could happen on site. Other general requirements include enclosures, that they're suitable and provide protection for the equipment, that there's guarding and barricading that's adequate, screens and guards, and proper storage is all included in these general requirements. Also, means of egress, complying with building code, so that's going to be different based on your state and your local jurisdiction, but means of egress should comply with those. There's also some call-outs for external, for refrigeration piping on where it should be located and what kind of temperature limits, as far as someone hurting themselves by possibly putting their hand on the piping by accident or coming in contact with that piping. So that's all called out in IAR 9 as well. Specifically for machinery rooms, tight fitting construction and 1 hour fire resistance ratings, I think pretty standard at this point, but that's what IAR is recommending as well for those of you who may not have to meet that requirement for local fire or building code. Piping supports, again, California, we've got seismic issues, but generally speaking, anywhere, having those proper supports and proper materials, having that evaluated by a civil engineer if you can, or confirmed in the drawings if it's a newer system. As far as airflow, you basically don't want ammonia to leak into your occupied spaces. If possible, containing it in the machinery room and away from the rest of your facility. And that combustible material should not be stored within the machinery room unless they're properly stored. And this, again, all goes into best practice. Egress for the machinery room basically should be, it says equipment installation should allow for it. You're basically talking about panic doors, so they open outwards when you leave the room rather than opening inwards. That's a safety mechanism that's built on a lot of fire doors in a lot of these rooms. Again, checking that you have that at your facility, and if you do, great. Documenting that and putting something in writing's helpful for all of this. Also, access to valves and when they should be accessible in an emergency. You shouldn't have to climb any ladders. You shouldn't have to climb any stairs to access those valves. In a non-emergency, it really doesn't matter as long as they're accessible. So knowing the difference, having those valves accessible, marking those valves. I know some facilities are now painting their king valve red or possibly other emergency valves red so that it's very clear, especially to a responder, that that's an important valve. I've also heard that some facilities are putting little pathways to their critical valves as well. So all of this kind of rolls into what's important for RAGAGEP and best practice, what makes someone's job a little bit easier and a little less confusing. Also recommended is some kind of buddy system when working around ammonia. There's a lot of arguments for that reason. If someone becomes overcome with ammonia gas for some reason during a leak, or if they just get hurt, maybe twist an ankle or whatnot, there will be someone else there to go get help. Also regarding machinery rooms would be pipe penetrations, sealing up that room, making sure that wherever your largest quantity ammonia is, it's protected from the rest of the facility. This is where low charge systems will become more popular because you can put them outside, have a little bit lower risk, and keep them from being inside the building. You can put them on a rooftop or in the back of a building where there's low risk as far as people being exposed to ammonia. And for those of you that use cylinders, basically only connecting those and transferring those by authorized personnel. EYEWASH stations and safety showers fall under other OSHA requirements, but here for IAR 9, there's a minimum of 2 units required, one inside machinery room, one outside. Remembering that egress or access to these should always be unobstructed and no more than 55 feet away. So you may need more. If you have to step over a pipe to get to the nearest eyewash station, you'll have to put one on the other side of the pipe. So you have one on each side. There's also, again, arguments for a buddy system on this one for this reason, to get you to that eyewash or shower if you become succumbed or if you are exposed to ammonia or may get in your eyes and stuff, you can't see where you're going. And there are other ANSI requirements surrounding this, so that'll vary a little bit facility to facility, but generally speaking, these are the minimum requirements. For electrical safety and hot work, just making sure they match electrical code, having those electrical classifications if necessary. Most machinery rooms are classified as ordinary locations, so the emergency ventilation will also meet that standard, but for those that aren't, that'll just mean you'd have to do a little more research as far as what's required for ventilation and for the occupancy. As far as hot work's concerned, just ensuring that you have proper training. If there's more training required, to make sure that that gets all done, and any improvements to either the hot work permit process or the procedures that you have in place at your facility. Drains and entrances and exits basically falls down to contaminant control, that there's a drainage system that will keep contaminants from entering the drain itself, so you can contain that in the room until you can clean it up. Also, that there's the limit of spread of ammonia to drainage. Again, even if it's the sewer, there's a lot of permitting and fees that go along with that if you do have a contaminant enter the drain. So isolating that is very helpful and beneficial from a business standpoint, but also from a safety standpoint. And as far as entrance and exits, we talked about that, having panic hardware, having 2 exit doors when you have a room larger than 1,000 square feet. Perhaps with your access to the room, 2 entrances and exits makes sense from an accessibility standpoint, even if you have rooms smaller than that. Again, these are minimum standards. And also that building code comes into play too. So if you have a fire or a building code that is more stringent than these requirements, then you need to follow those. For lighting and emergency control, basically, there needs to be adequate lighting at the working level. They specify at least 30-foot candles, so either measuring that or having some kind of assessment on whether that's adequate at your facility is important. For emergency control, your emergency shutdown switch should have a tamper-resistant cover and should have an off-only control for the equipment within the machinery room. It should be located outside next to the principal machinery door and possibly somewhere else on the facility, and clearly marked. So it should be marked as an emergency shutoff switch. And again, some people are putting big red signs next to these switches, authorized access only, things like that, to make sure that it doesn't get inadvertently pushed. And you should be testing your emergency switch every so often. There's established schedules. Everyone kind of uses a different schedule, but testing that switch to make sure it works and it's adequate and shuts everything down appropriately. Also, emergency ventilation should provide an on or auto override capability to be able to switch that emergency ventilation on, even if it doesn't automatically go on, that you can actually manually turn it on. And that should be located outside at least the principal machinery room door, if not multiple locations. For detection and alarms, there's a lot of requirements on these. I know California falls more strict on the alarms than other states. So IAR has established a standard that can be applied federally and internationally. If there are more strict requirements within your state or within your county or city, definitely want to use those, obviously, to meet their requirements. Generally speaking, there should be an alarm set point for just an alarm at a relatively low concentration, but a health hazard concentration. IAR 9 says 50 ppm. Then there's an emergency ventilation that should kick on. Again, IAR 9 says 1,000 ppm. It may be lower, or I believe California is 150, if I remember correctly. and de-energizing the equipment at 400,000 ppm for IR9. Again, it may be lower. I believe California is lower than that. And also a reminder, in some of my RAGAGEP series, I kept talking about a monitored location. That means a location that's going to be, like a phone's going to be answered or a text message system is going to be answered 24/7. So it has to be accessible at all times, whether it's a security gate or a manager that's on call or whatnot. It needs to be monitored, as in 24-hour availability. And so from IR2, we have the alarm set points and structure for the 3 levels, which is also a good reference to balance out IR9, where they do go through exactly what should happen at each level. And I've talked about this in previous webinars, so I won't spend a lot of time on this, but at each level, what should be occurring and what kind of alarms and set points you should have. So if you have any questions on this one, either see my previous webinars from, I think, last year or the year before, or also look at IR2 specifically for this. In addition, power supply for your alarm systems should be on a dedicated circuit, and you should have that power on at all times. That would be your emergency generators, again, separate circuit that's separately run from the rest of your equipment. Any power failure should trigger a trouble signal and then hopefully kick power back on. You want to know what your alarms and detectors are doing. It's a safety feature that should always be active. You should also be talking about this in your PHAs to make sure that all that backup power is working appropriately. And then accessible for maintenance and testing. Those obviously fall under some kind of maintenance program. For ventilation, IAR talks about the machinery room area and what kind of ventilation should be under normal occupancy, and then talks about exhaust ventilation. Essentially, you don't want to cross-circuit or contaminate your airflow, so having your air ducts and intakes and outlets designed so that you don't have an intake bringing in contaminated air. Also that the temperature does matter sometimes, so accommodating those ambient temperature, especially in extremely hot or extremely cold climates, you don't have a problem with that. Exhaust should discharge vertically upward, again, to avoid that cross-circuiting. And then also the IR9 requirements talk about non-sparking blades and fan motors and how all that should be oriented and what type of material should be used. Again, inlet air basically should replace air being exhausted and shouldn't short circuit. Screens and any kind of louvers and such should all be corrosion resistant. You shouldn't have any problems with that. It should flow freely and should also be operable whenever you need it. Louvers should fail open, and during power loss you still get that airflow through there if needed. As far as temperature control ventilation, IR goes further to dictate what a proper temperature would be in a machinery room. Again, building code or local codes may dictate that it should be lower, but 104 degrees Fahrenheit, which I would consider pretty uncomfortable, is the minimum standard, basically no higher than that. For emergency ventilation, having that automatic detection and activation is required by IR9. Again, powered independently, so having that backup power available in an emergency with your alarms, emergency ventilation should be part of that. The design basis and the actual design itself with drawings should always be documented. That should go in your PSI or safety information section. And a monitored location should be notified of loss of power. Kind of tying that into the alarms, so very similar requirements as far as notification. For pressure relief devices, it's pretty standard now, but having the hydrostatic relief where you can trap liquid ammonia is very important, and also having the dual PRDs or PRVs on a 3-way valve. IR2, I went back and looked at IR2, that the discharge should be at least 15 feet above grade or 20 feet from windows, ventilation intakes, or exits. It does specify that specifically. And I know in California, I think the rules are a little bit differently. So again, you California facilities, you may have to look up other standards. These are going to be below your local standards. And a determination of discharge should be directed away from where people can be. And I have seen that on site. It was addressed at that particular point. but designing the system appropriately so you don't create a hazard for those on site. As far as compressors are concerned, looking at where isolation valves may be and if there are more that are needed to take a compressor offline. Looking at automatic shutdown overpressure protection. They count as safeguards, so it ties in the PHA, but it's also one of those best practices, and for not only for business but also for safety. For high liquid level in the vessel, connected to compressor suction, there should be an automatic shutdown for the compressor. So again, working with increasing the safety of your compressors, having those pressure reliefs and pressure limiting devices. Shutoff valves should be appropriate as far as materials and connections. You should be using the right metallurgy to use with ammonia so you don't get corrosion issues. As far as placement, the IR9 goes into some detail as far as where a shutoff valve should be located, especially when we're talking about like isolation type shutoff valves and inlets and outlets of some of the equipment. And basically trying to avoid trapping ammonia or being able to close an upstream valve and then closing a downstream valve once you've evacuated the equipment. For piping, not obstructing any kind of ingress or egress or walkways, not placing piping where it could create a hazard in an enclosed space, and that would be your elevator shafts, dumbwaiters, any kind of moving object that could impact that piping, as well as being a contained space. Keeping that away from the public, not accessible to the public. You should be running all your piping either inside the facility or on a rooftop or being protected in some way, shape, or form. And also applying the correct insulation where necessary. As far as instrumentation goes, IR9 basically dictates that you have to have the ability to manually or automatically control starting, stopping, and operation of system equipment. So it has to be both. This really applies more to older systems. I know a lot of newer systems, you basically can break out your iPad and control the whole system, but there needs to be both a manual and an automatic, so you have the access both at the facility and through remote means or through automatic means. Also, having that ability to monitor concentrations if there's an ammonia release when the power's out. Again, going back to your alarms, detection, and emergency systems being on a separate power grid. Even if the power goes off, those will still operate. And having the safety settings be limited to authorized personnel only. So locking down some of those controls, having things password protected, or controlled access of some way, shape, or form is really important with these systems. Liquid level indicators should have protection from physical damage. You shouldn't be able to hit them with a forklift or with a truck or something. They should be compatible with ammonia. They should have some kind of shutoff valve so that you can take that offline if you need to change it out or whatnot. And also shouldn't be used where a hydraulic shock can happen. So here's kind of the important part of this standard to me. It's the evaluation. And what IR9 states is that there needs to be an evaluation to document RAGAGEP compliance. This is really important because up till now, most of what I've personally seen is a statement that says we meet RAGAGEP. And might go into a little bit of detail, that's essentially it. So what the standard does is it says, okay, that's fine, but now you have to have a document that says you've evaluated RAGAGEP and how you've met RAGAGEP. So there's a couple options to do that by. You can use IAR9 standard, which we've been talking about, or you can use IAR2 with other codes and standards if they've been adopted by the local agency. And that would, since IAR2 is referenced in a way to IAR9 and was used as a guidance, essentially, you should be using IAR9 unless you have a good reason not to. The evaluation needs to be conducted by someone knowledgeable in this RAGAGEP and the system itself. It's team-based, similar to a PHA, and we'll get to that, I think, in the next slide or two as far as how to tie that into your PHA, because you'll have to do that. But it is team-based, so you probably won't have just one person doing the evaluation. It is possible, but it probably will end up being some kind of team collaboration, even if it's not a formal setting or a tabletop type discussion. So RAGAGEP evaluation is going to review system documentation. applicable RAGAGEP, so that would be your standards that you're measuring it against, and any kind of physical inspections necessary on the system. So when you're verifying materials or valve placement and whatnot, that would be your walkthrough. All the results should be documented. Appendix D of IAR9 has an example. It's essentially a checklist similar to what you would see for a compliance audit that goes through and says, does this meet, lists the requirement, does this meet the requirement, and here's a notes section. So, and a recommendation section. So that does break it down into a table. They give an example again in the standards, so feel free to look at that. But it's set up similarly to a compliance audit. Then documentation has to address the gaps. So if you find a recommendation or gap or finding in your evaluation, you essentially either have to close the gap and by RAGAGEP standards, or you need to justify why the gap doesn't need to be closed by an approved method. So those approved methods listed in the standard would be some kind of semi-quantitative technique for risk-based ranking. So you could do similar PHA technique. You could use a LOPA technique to justify not doing it. You're basically to address the risk ranking and that the risk is not high enough to have to correct the deficiency. You can use a quantitative risk analysis or fault tree analysis, which goes into a lot of depth. But again, you can use that maybe perhaps on bigger systems. I probably wouldn't recommend it for smaller issues. Or you can just get approval from the local regulator. So there's a lot of ways to address recommendations. If you can't close them, don't feel like it's necessary or whatnot, where it may be required by RAGAGEP, but you've established that the risk is low enough that it doesn't have to be done. And here's the important part. The frequency of these evaluations is that the initial evaluation has to be conducted with the next PHA reval or the next hazard review and shall be revalidated every 5 years. They recommend doing it with the PHA. Now what's important about this is if this gets passed and finalized in early 2019, specifically for California and for all you other facilities that might have PHAs coming out in 2019, you'll have to be doing this in 2019. So you'll have to be evaluating the RAGAGEP for your facility in conjunction with that PHA. So if you're planning on your 2019 PHA at this point, I would probably start looking at the requirements here for the RAGAGEP evaluation. It's still going to take some time, I think, for this to trickle down, but as soon as this is final, essentially the regulators can hold you against this if you're an ammonia refrigeration facility. If you're not in refrigeration, there's still some kind of standard out there where they could say, okay, well, it's not directly applicable to you, but there's some good guidance in here. And they can use that to establish their own guidance and requirements for you. So this is why we want to be paying attention to this now. I've been following this for probably 1.5 years, 2 years now, and we're finally coming to the end point where it's going to be really essential for everyone to pay attention and just be familiar with what's in here. Again, this is especially important for 2019 PHAs, but going forward, this will be included or should be included with your PHA revals. Some additional RAGAGEP, I'll go through a few slides of just general RAGAGEP on top of IAR9. Again, this is applicable to all facilities, so not just refrigeration. I'm looking at other methodologies for PHAs. Does a HAZOP make more sense over a what-if checklist? Should maybe a LOPA, or even going further into a more complicated system and do a DMR similar to what the refineries are doing? Some of this, you're probably saying, oh, this is overkill, but it's essential to kind of entertain this idea of, do we need to do more? Do we need to look at this closer? Maybe there's only certain scenarios where you do some of these things, but establishing this best practice and having that safety culture in place. Also, just reevaluating the controls, the safeguards, looking at facility siting again, not just skimming over it, but really looking at it, looking at human factors. Is there any history since the last PHA or the hazard review that you've addressed or need to be addressed from incidents? Team makeup, is there another person you need on team? Maybe fewer people on the team next time. How to manage recommendations. All this is kind of rolls into best practice as far as improving not only the efficiency of a PHA, but also the quality of the PHA. For operating procedures and contractors, looking at your SOPs, is there anything more you can do? Any more detail you can add? Is it helpful to have those operating limits front and center on your SOPs? I've seen that a lot now, people improving things, improvements on training for SOPs, maybe more hands-on training, and any kind of tracking method for revisions that happen. Also for contractors, having those training records. I think most contractors have gotten used to being requested of information regarding their training and safety records, but getting that, making sure you have a system in place to keep track of all of that and evaluate performance of contractors. For training, again, looking at improvements of where training can be done. I've seen some facilities go to quarterly training where they will rotate topics throughout the year so they have trainings more frequently. That usually helps because it's constantly reinforcing some of these ideas. Even if they're different topics, it's this idea of having the safety culture and having a safe practice. Does HAZWOPER make sense? Or maybe you haven't done it before, but it makes sense to do it now, even if you don't require it as far as your practices on site. Just knowing what to do if you have a hazardous material on site may be beneficial, may not. Also tracking mechanism for training, having some kind of checklist or spreadsheet or program that tracks all your trainings that you're doing, making it easily accessible. Again, trying to make it easier, more cost effective and more streamlined to not have to track so much paperwork that kind of goes everywhere. Management and change and PSSR, again, improving the process, improving your procedures. Is there something you can do to streamline it for next time? Are you using the correct technical basis for the changes you're making? Are the correct people involved? Is the information coming from the right place? All of this kind of gets incorporated into anything to improve the process when you talk about your MOCs and PSSR. Incident investigation, again, need to go further as far as drills and practice scenarios. Perhaps you had an incident on site and it didn't go as well as you thought you had trained for. Perhaps that means you need to improve your training on specifically for incidents and emergency situations. Doing those drills with your local emergency responders also very helpful. Having full-scale drills for your emergency response teams on site. All of this is beneficial if you deem it appropriate at your facility. Having those forms and procedures up to date, contact information up to date, employee participation, ensuring that your employees are active in this program, that they know what it is. If you have a safety group that manages a lot of this on site, that they are aware of these programs and they understand at least the basics of what these programs entail and what should be done. So again, going forward and kind of looking at the future a little bit, IR standards 9 and 6 are still being developed. IR 9 is in its last public review as far as the last information I have. IR 6 just finished a public review. I think they'll probably go through 1 or 2 more, so that'll follow a little bit later in the year next year. But just considering the fact that these are minimum requirements and standards, there may be more that you need to do, and that's really up to the facility and the local regulator to work together on. Always having this culture of looking for improvements, the safety of design or safety of practice and implementation on the system, striving for safety of practice, and providing feedback when these comment periods happen. That's really important because these are ANSI standards. They go through periodic public review, and to be on the lists so you get the emails when these come out is really important. Getting diverse feedback from end users to designers to contractors to operators and consultants. It's really helpful that they can balance this business and regulation together with the standards. So it provides a balanced approach. Last time I gave this presentation, I had someone ask, well, why is IAR doing this? We don't need more regulation. And my response was, would you rather have a regulator tell you what to do, or would you rather have an industry group that has a multitude of different kinds of people in different states and countries come together and make a standard like this? And that's really what they're trying to do. So it is really important to get involved, to provide comment when necessary, read through these drafts. If you have a problem with something, definitely write in. They respond to everybody. They have a formal process to evaluate all the comments. So there is a lot of work that goes on behind this from the Standards Committee periodically to update these standards. As far as RMP is concerned, we have another webinar coming up later this month on Inherently Safer Design by Jasmine. We also have one by John that's been pushed back a few times. We're hoping to schedule that soon. We don't have a definitive date yet. He's been traveling a lot. Ryan and I will be at the RETA conference in Dallas, so if any of you are watching and will be there, please come see us. We have a tabletop and we'll be presenting. I think we're speaking, between the two of us, we're speaking a total of 6 times, so there's plenty of time to see us if you like to see our faces. I have a workshop and a paper, and Ryan also has a paper, which I have to say is really helpful if you're looking at your emergency response plans, emergency action plans. And we're also going to be over at the IAR National Conference in March. Again, I will have one of those topics. I have a similar topic at RETA, so I'm talking about remote HAZOPs. 2 different conferences, so if you don't make one, try and make the other. And we've also done a webinar on it. But we'll go ahead and we'll be at IAR with a booth as well, so please come see us. And with that, I will open up to questions. And also, while we're waiting for questions, Karine is going to be sending out a survey or a poll real quick. This was a different time for us due to scheduling conflicts. Just want to know whether or not you like this time, not like this time, or you kind of don't care. Maybe we'll mix it up with the different webinars and see what works for everybody. But please give us your feedback. It's really helpful, especially if we do have a preference on timing and when things should be. And with that, I'll go ahead and see if Karine has any questions coming in. Oh, and also I'll give a plug for the hopefully soon podcast coming out. We've been working on this for the summer and just haven't quite got together, but we have a number of topics lined up, and we're going to get that going later this month as far as recording and getting a podcast out. More conversational, but similar topics to our webinars, so that should be exciting, and just stay tuned for that and look for that information when we email it out.
All right, I do have one question. Are there similar documents like IIAR 9 that discuss minimum standards for existing systems for other processes or services?
Okay, so just to repeat the question, are there other standards for other industries other than IIAR 9 that have this kind of information for best practice? I mentioned a few before. Actually, let me see if I can get that up real quick. Mentioned a few before, for instance, actually, I don't even think it's showing up on the... It's okay. I mean, it's okay. I'll just answer a question. The Chlorine Institute, if you have chlorine on site, CCPS is a good, okay, there you go, I have it. CCPS is a good reference for guidance. It's more on the lower end. It's a non-consensus document, but CCPS is a good one because it kind of stays general, focuses more just on chemical process safety. There's technical articles. If you go to conferences and see technical papers based on some of this information, absolutely. ASME and ANSI also have other types of standards that can be incorporated, and then going up, kind of moving up the ladder, NFPA building codes, things like that. Specifically speaking for IAR, because it's focused on ammonia refrigeration and it's an industry group. I don't think there are a lot of industry groups very specific like they are. So I'm not entirely aware, but again, just generally speaking about chemical safety, CCPS or AKI would be good places to start.
There's one other one. Some aspects of the new RMP requirements were effective October 8th, emergency response, incident investigation, supervisor training. It was mentioned in this webinar that 2021 is the compliance date, which is correct.
Okay, so the question was about the new RMP rule, that some of the requirements went into effect basically a couple weeks ago versus some deadlines that I mentioned in March 2021. What I believe, and again, we're still getting into this because we just got this information a couple weeks ago as well, is that it's effective right away, but a lot of the deadlines aren't until March 2021. So they're giving people time to meet those requirements. Again, I wouldn't wait for the last minute, but starting to get on top of that, and I think it's generally assumed that the sooner the better, or as soon as applicable. If you're interested in more information, again, I haven't spent a lot of time with that. just from being busy with other things in the last couple of weeks, but that is something we are going to start looking into a little bit more as far as what the actual requirements are, like when things are due and what specifics are in those regulations. I know there was more detail than even the fact sheet that the EPA release had as far as additional detail for meeting these requirements and meeting what's regulatory.
I do have another question. What RAGAGEP applies for older ammonia refrigeration systems before 1980?
So the question is what RAGAGEP applies to systems built before 1980, and essentially it's IAR 9. IAR 2, again, is for new systems, and newly designed systems is basically a design standard, where IAR 9 applies to existing systems. That's all existing systems, including your older ones. You could go back to 1915. I think there's some systems that are even out from the early 1900s, more so on the East Coast, I think, because they've been established. But this is what you'll be looking at, is these IAR 9 standards for any existing facilities.
That's it.
All right. If there's any follow-up questions, you all have my email on the slides. I'm also accessible through the website, and just give me a call or whatnot, and we'll go ahead and take care of those questions. This recording will be up in the next week. Usually it takes us a day or two, but we like to give ourselves a week in case we have some technical difficulties. And I hope everyone has a great day. And again, if any of the follow-up as far as RMP rule and whatnot, we'll be doing some releases, maybe even it's a good podcast topic to make note of, and we can go ahead and release that. So thank you very much.